Well, we're super excited to have you here because you're truly one of our favorite doctors in the world. We just adore you and we adore all the education that you put out there. And we're excited about this topic. Truthfully, Yasmin and I avoid the topic of weight loss because we
I
are just
understand.
not experts in that space. And there's so much nuance, especially when it comes to what is a healthy weight for someone, at what point should we actually be giving them advice to lose weight. But we know that weight is a huge goal. It's probably the top goal for a lot of people who are on their health journey, weight loss, I should say. And it is an important marker. So, can you talk about why weight is an important measure and it should not be completely thrown out?
Yeah. Well, first of all, thank you for having me. It's always the best to talk with wonderful women like the two of you. So I'm honored to be here. And I like to start this conversation just by saying anytime I talk about weight or weight loss in air quotes, I want to enter the dialogue with the utmost amount of compassion and humility and respect and hopefully nuance is what we can talk about as we chat today. And it's good to talk about this because obviously this has been a conversation. People have been interested in this topic for forever. But there's like the volume knob has definitely gone up lately as we have these new medications to kind of support people that are struggling with conditions like this. And at the end of the day, maybe my thesis is that we should, and I champion that people love themselves completely because who we are is not our physical body. But at the end of the day, our physical body is certainly vulnerable to certain realities, right? And we know that people that struggle with obesity or being overweight are going to live with an increased risk around metabolic disease, around cardiovascular disease. They are going to be more at risk for cognitive disorders like Alzheimer's, more likely to have hormonal dysfunction like polycystic ovarian syndrome, and even cancer. And they're also at risk for comorbidities like hypertension and sleep apnea and non-alcoholic fatty liver disease. They tend to have a more complicated perimenopause and menopause transition, and even are at risk for preterm death. So I just put that out there to say, like, this is about health and this is about wellness. And as someone who is so passionate about people feeling their best and living their best lives from a health perspective, we have to have this conversation. 42% of Americans right now are struggling with obesity, and 30% of people in America right now are overweight. And those projections are even higher as time goes on. And we've had this chat before, the three of us, about metabolic health and how, maybe even if you're not overweight or obese, that most of Americans are not metabolically healthy, right? So I think having this conversation is important, but the nuance, I suppose, is trying to have this conversation in a way that is maybe a little different in the way that I think about it and kind of, has some foundations that may be different than the classic experience somebody has when they pop into their doctor to talk about this.
And the first question that comes to my mind is, you mentioned early on, there's so many nuances, which I love that aspect and that approach. So how are you approaching the conversation around weight loss?
So first, I would say that I think that weight loss kind of needs a rebranding for staying in the times of talking about, marketing in that way, because it's so charged. Like even just saying weight loss, like people have immediate reactions, right? Visceral reactions. And it's fair because, oftentimes there's psychological trauma related to weight and how people look. There is all kind of stress around societal norms. There are cultural beliefs. There's nutritional dogma. I mean, it is like a landmine, right? So I really try not to use weight loss, although we may, just for simplicity as we chat today, and instead talk about supporting optimal body composition and or energy balance. And when I say those things, body composition is really kind of what it sounds like. It's more like, what are the metrics, what are the numbers, right? Let's just get super kind of clear and dry and think about numbers. So that could be, body fat, or that could be waist hip ratio. And we can talk about all of those things in time too. But really just looking at the numbers and how those numbers connect with risk when we're talking about health. And then alternatively, like sometimes I may talk about it in terms of energy balance. And here I'm saying, you know, of the things that may affect kind of like what's coming in, and that could be calories, that could be toxins, etc. How is that weighing with what's going on the inside? Like, how are your mitochondria functioning? How well are you burning that energy? What's happening with your hormones? And just even changing the language, I think you have a different opening space with somebody, right? Like they may be like able to hear you in a way that like, well, you need to lose weight, or we need to talk about weight loss, like the doors are closed, right? So I think that's like the first piece of what I really try to start with when I go into this journey with people.
That's so interesting because, you know, when you go to the doctor, as you mentioned, if you go to a conventional doctor right now, one of the first things they do is weigh you. And I know that can be a very triggering experience for a lot of people. In fact, even now when I go for my pregnancy checkups, they say, do you want to know the number? Because a lot of people feel shame around that number and they might not want to even know it. It might trigger something in them. But it is an important number in so many respects. But I know this might be a tough question, but on a scale of like you speaking to somebody, at what point does that number come into the conversation? When is it important? Are there other things that you need to address first? Because so often at a conventional practice, they'll say, well, this is happening because you're overweight, without looking into any of the other factors to consider. Whereas me, a skinnier person, those topics might not even come up just because I'm skinnier.
Exactly. So I'm going to answer your question, but I'm going to start by picking up on, you know, what you were talking about like, is there another piece of this that we need to think about first? And, you know, part of what I have found successful over the years, and my background before medical school was in nutrition. And so food and body composition, this has like always been in my brain and like what I'm passionate about. And what I think is really important, there's like three things that I think are kind of make the, you know, approach towards helping someone with proper body composition amazing. And there are metrics included. So I'll get back to your question, Kaya. But first, I just want to say, I think that number one, you have to prioritize connection and understanding who your audience is. And so I'll say more about that. So you were kind of saying like, you know, and I hear this all the time, like a woman will come in and she'll be like, well, I went to the doctor and, you know, my knees are hurting. And I said like, oh, my knees are hurting. And they were like, well, you obviously need to lose weight, right? Or whatever it is, I'm tired. Well, if you lost some weight, this would be better. And I mean, for me, my like skin just feels agitated when I hear that, because it's such a like disconnected way to engage with another human being, right? Like, and I think that the first thing that you really need to do, I mean, generally, but like since we're talking about body composition and energy balance, is to have a connection with somebody, right? Like, who is this person in front of you? Do I have a relationship with you? Do I even have like a ground to stand on to start having this dialogue with you because I know you versus I don't? And then in that, like, I've kind of like, in my experience, there are some pretty classic archetypes that come up for people. And so we can go through some of those just to like get a sense of what, you know, what's pretty common. I think archetype, let's call it A for simplicity, is like the woman, and I mostly am working with women, so this could be anybody, but let's just say it's women, the woman that comes to me that says really nothing about their weight, but it's clear that they have been struggling with obesity or being overweight probably their whole life. And I may be aware of biomarkers or other things that tell me like, I need to be worried about this person. I need to support this person. But I also know that this is someone who's probably, because they've said nothing to me about it, right? This is probably someone who is struggling with shame, with trauma related to weight. And I will wait to have that first conversation about weight until we have a relationship, right? Because that's really important. And that's what's going to determine success is, does this person feel safe? Do they feel heard? Can they really feel like they can come to me and know that I'm going to be curious about what the barriers are and what things are difficult for that person? And then there's archetype B, who's like the yo-yo dieter, whole life, tried everything under the sun. Sometimes it's worked, sometimes it's not. And really this person maybe is the dyad of stress is less between her and the provider and is more between her and herself. Right? So she's like mad at her body. She thinks her body is not working. She's tried all the things, nothing ever works. And in this person, we're not going to talk about weight or anything associated with it until there is a new, whether that's meeting with a therapist or however we get there, a new connection with self. That's the foundation upon which like there is confidence and there is like solid energy to have these difficult conversations, right? And then there's archetype C, and these are just my classic ones. And this is a person who maybe like looks like they don't need to have this conversation, right? They don't look like they are struggling in any way, but you check laboratory and in fact, they have quite a lot of metabolic dysfunction, right? And this person, like, it's like a different pivot. Like this is probably a person who's going to feel surprised and maybe anxious if you start talking to them about what they need to do to improve their health, because they've lived their whole life not being like, well, I don't, you know, whatever. I wear small a size 2 jeans and like nobody's worried about this for me. So those are the classic ones. And then I would say like a smaller subtype, and this is an interesting one, is the person who comes saying they want to actively lose weight. And yet, like, this is probably some form of disordered eating or disordered body image. And here I have to be, I would never like shut this down, but I hold the space for, let's look at the numbers, right? So you'll find as we talk about this, like I tend to come back to numbers and biomarkers a lot. So we move away from like shame or moral judgments. It's like, no, these are the numbers, right? Like it's very factual. So that's number one, is like the connection and knowing your audience. And then I would say number 2 is probably mindset, right? Like this is so important, the mindset part of any kind of successful health program. And in that, there's probably 2 wings that I have. One that I think we hear commonly, which is like, you really want to figure out what is the thing for this person? Like, what is the motivation for them? Why did they care about it? Not why does their partner want it? Why do I want it? Why do they want it? And it can be something like, well, I want to be able to go on this hike in the Alps in 5 years. Or it could be, you know, I want to be able to help my daughter when she has babies. There's no wrong answer, but it really has to be specific and like connected back to the person in front of me. And then with mindset, I love to celebrate little wins. So every day, every time we meet, we're like, well, what's going well? I drank 32 ounces of water today. Amazing. That's awesome, right? Like just staying in the energy of success and positivity and winning is so important. And then lastly, I always want to think about what can we add, how can we gain versus what do we take away, how do we restrict? And so that, I'm sure we'll get to that, but that's whether it's about food or exercise or muscle acquisition, I'm always supporting the like add more in, gain more as opposed to lose. And then I'm happy to get into the more metric thing, but I wanted to really like frame that because I think actually that's the most important thing before we even get to like, what is the number on the scale? What is your waist hip ratio, etc.
That is so beautiful. I mean, I hope that people are re-listening to that because a lot of doctors don't think in that aspect. You know, like you said, even outside of a, you know, weight loss, quote unquote, journey, it's so important to think about the motivation of yourself, your mindset, your healthcare provider for any healthcare journey. I know, at least from my own perspective, in terms of like family planning and fertility, and you're my doctor, Anjali. We'll have to do a separate podcast just to talk all about that. Yeah, it'll be fun. But I've met with a lot of people and they don't really understand my motivation. They're like, don't do this, don't do that. I'm like, but that doesn't add to the abundance mindset and feeling like expansive, which I definitely want to talk more about in this context. But before we go there, I'd love to kind of hear these biomarkers you were saying. You were talking about how that is one thing that you always lean on, no matter what archetype this woman falls into. So maybe we can kind of start there.
Yeah, so I will like blend your 2 questions and I will say, okay, I do sometimes use a scale, very rarely, and I don't like pay any attention to it. I think it's just a random number, and honestly, I trust my intuition about the person who probably gets on the scale every day and doesn't care, and the person who doesn't want to be on there. And truthfully, the primary motivation for the scale is really like, I have to enter it into the EMR, you know, like otherwise, like I would just not do it if it wasn't for that. But I love the waist hip ratio So, looking at in inches, or you could do in centimeters, but I'm trained in inches, what is the, inch circumference of your waist compared to your hip? And it'll spit out a number. And we really want that number to be below 0.8. And that is because above that number, we're worried about, things like visceral fat, which can be incredibly inflammatory and problematic when we're talking about health. So that's one metric I always want to use. And related to it, and this taps into root causes, when somebody has a high waist-hip ratio, but their body fat percentage is normal, then most likely the mechanisms that are contributing to the ways in which they maybe have an unhealthy amount of weight on their body is related to the gut microbiome, to detoxification like defects or hiccups, and or hormones, like some kind of hormonal dysfunction, be it big hormonal dysfunction or mild subclinical hormone dysfunction. And if the waist-hip ratio is high, but they also have high body fat percentage, then I know that that's most likely a primary metabolic problem, right? That's more in the category of insulin, glucose, those factors are playing in. And I think my experience is I find that this is really helpful for people again, right? Because it takes us away from this moral act, disposition of well, you should be doing this or that. It's no, there are mechanisms that are involved in why this is happening, and I can help you identify those and support you to make those better for yourself. So those are two really common ones. The body fat percentage you can get by either doing old school calipers, but I actually have a bioelectrical impedance analysis machine in my office, so BIA for short. And this is using electrical current when you stand on it to there's a different way that the electricity is going to move through fat versus lean tissue. So it will spit out, your estimated body fat percentage, your visceral fat, so here's another marker that I'm looking at for people, and then your skeletal muscle mass. And so here's where some of that build energy comes in, because oftentimes I don't even get too focused on what's the body fat, what's the visceral fat, unless I see that a patient really wants that. I go straight to how much skeletal muscle mass do you have? And is this enough to support your optimal energy, your optimal health, your best hormones, your longest life? And we just focus on that. And honestly, if you can help people continue to build muscle, all of the rest of those details will basically fall into place eventually, but you're not having such a triggering conversation, if that makes sense. Right? And then lastly, I do biomarkers, and I'm happy to tell you about those, but that's more blood work related.
I love that you said that, because I talk to so many women all the time who tell me essentially the same thing. I don't eat that much and I move a lot and I'm just gaining and gaining and gaining. Some of them are not even in perimenopause or menopause. Some of them are younger than me, and they just feel like they're doing everything right according to what they've seen, but they still seem to be gaining weight. And what you're saying is that there are so many other mechanisms that could be at play here. It could be their thyroid, it could be their gut microbiome, it could be their detoxification systems, something else is going on in the body. And so earlier you mentioned this idea of energy balance. So let's talk about what that means, and what is a successful energy balance program?
Yeah, so, the first thing that we talked about was getting some of those numbers, understanding where they are on the muscle to fat ratio. So that was then going to prompt me to help them identify what is the right exercise for your body, right? If I see that they have significant, good, strong muscle mass, then I'm not so worried about that. And I may say okay, exercise as you are, this is working for you. If I see that compared to, total pounds mass of fat, that their muscle mass is kind of on the lower end or not even optimal for their age, because really I like to see skeletal muscle mass as high as we can take it at any given age that you come to me, because that's protective, right? Then I'm going to focus on giving them a more strength training focused exercise program. So that would be part of the energy balance, right? Everyone's going to get a nutritional program. And I think this is somewhat individualized, but, broad strokes would be good amount of protein, half of your plate is vegetables, really fiber forward, so shooting for that 35 grams of fiber a day. And then, I like to tell people to space their meals and to chew. So there's actually a cool study that was done that like compared, a placebo to folks that like chewed their food until it pulverized in their mouth and then swallowed. And isocaloric, so like they were eating the same things, and the group that chewed without distraction until it became liquefied and they swallowed, then after that, they ended up losing weight for the duration of the study, doing nothing else. Right? So it's like this world that we live in where we're like on our iPhones and eating, we're like writing emails and eating and like chewing and swallowing before we can even like be aware that we've eaten. Not so great, right? And so sometimes on that food score, it's like, maybe that's the only thing that I will say, because this is where you have to again know your audience. Like, who is this person? Are they going to be overwhelmed by something that I recommend, or are they going to handle it? And then on the other hand, like some people need they want an app, they want to put in everything, they want to measure in grams everything they're eating, and they like that. And so that's amazing. So that's kind of the nutrition exercise part. And then, no matter who comes to me, we have to talk about sleep and stress. And as it relates to kind of like optimal energy balance or body composition, this is really where you're balancing hormones like cortisol and leptin and ghrelin, which manage your appetite. So those things really need to be addressed. And that kind of like covers maybe lifestyle of energy balance, right? But then if we were thinking about like layering in more of the functional medicine side, it really depends on what I've learned from those calculations that I found and the biomarkers that I've checked. So, if you're struggling with subclinical hypothyroidism, or let's say maybe you are perimenopausal, how am I going to support the hormone milieu to give you the best chances of this being successful, right? Alternatively, maybe you have 7 billion mercury amalgams in your mouth, and we need to think about detox for you, because that is impairing your ability to lose weight, because it has a negative impact on metabolic markers and metabolic processes. So then we're focusing on detox as we're doing all of this other lifestyle nutritional medicine piece. And then sometimes it's more of the psychological side, right? So maybe all of those things, the guts, the hormone, the detox, the metabolic even is actually okay, but there's a big psychological piece of what's happening with eating, why are we eating, what's the trauma involved in that, and that, I will engage the help of other colleagues to help me support this person really find ease around that, because that can be, a big barrier in success. And then I love the tools, right? So I'll use continuous glucose monitors to help people, and I find that these are amazing because it takes out that like, oh, this is a good food and this is a bad food. It's like, put it on, eat what you want to eat. And then the way that I try to invite people to think about it is figure out what your body loves, what you thrive with, and what your body maybe is not so happy with. And then it's less, again, about this like, am I making a good choice? Am I a good person? And it's like, no, just listen to what your body says. It's going to tell you the truth. If it likes what you're eating, great. It'll tell you. If it's not working for your body, you will know that. And then you can make this like empowered, positive, compassionate choice for your body.
I love when you say that and when doctors say that, because it's almost like you have to step into your left brain and become just like more analytical. Like, what are the numbers? What do they say? Separate my emotions from it and then make adjustments according to that, which I know is a lot harder for women to do. But it's been, even for me personally, it's been so much better for my mental health to just say, hey, this number might say this, but it doesn't mean anything about me as a person.
Correct. Yes, that's so important to like depersonalize the information, right? Like we don't have to identify with it. We just look at it as, here's this number and like, what am I going to do about this? And it says nothing about me as a human. Really, really important.
I love that. And I'm curious, Anjali, you mentioned some of the tools, and one of them is a CGM, which I also love, and I think it's so helpful to see the data there. Any other tools that you like? I know you hit so many aspects from sleep, stress. I mean, there's so much we can tap into, but maybe if you have top favorites when it comes to tools.
Yeah, so I guess this goes back to like, it depends on the person, but I do think that tracking what you're eating can be a really effective tool for the right person. For the wrong person, it's just going to drive up like stress and neuroticism. But for the right person, it's like this really empowering, like, oh, this gives me a lot of insight into what I'm putting into my body, and I like tracking it, and I feel in control when I do it, and that can be really positive. So that's probably another like tool. And then I would consider like the BIA machine that I use as a tool also, because any person that it's engaging in this kind of energy balance journey with me, every time we have a follow-up, we're getting back on that BIA machine, and it helps us tweak, right? So, oh, let's say this person really loves to do Pilates, and they're like, okay, listen, Dr. D, I know that you love to lift weights and you want me to do that, but the way I want to do my resistance training is to do Pilates. Great, that's awesome. But then let's follow the numbers, right? And if we see that this Pilates training program is like just keeping you here on your muscle mass, then again, it's not, Pilates is not bad, you are not bad, but there's a mismatch here, and we've got to figure out what else do you find joy in that's resistance training, but that you can do to move this number in a way that's going to be favorable for your health.
I want to ask a question, and you can also feel free to skip it, but I'm very fascinated and interested in what's been going on with these GLP-1 agonists and weight loss drugs that have taken the world by storm, and maybe potentially if there are benefits to microdosing them for certain people at the right time in the right way. And just like the way that somebody who might be struggling with depression might need a medication to just get them to a certain place, and then they can work on everything else in the meantime or after they feel like they're mentally safe and okay. What are your thoughts around this? I'm sure maybe you work with some people who are taking them or considering taking them. Just if you have anything you want to share.
I would love to share. Yeah. So, I mean, I think in general, you'll find that I tend to like land in the boring middle about most things. I don't get super polarized about anything. And that's because I can usually see in the right person at the right time in this patient-centered approach, like there is utility for almost everything, right? Almost everything. And I have prescribed these, infamous GLP-1 agonists, and I think that they are incredible drugs. I think that they will revolutionize the lifespan, the health span for people struggling with obesity and being overweight. Even in this approach, which is so comprehensive, there are times when we're still stuck, right? And this is a person who's highly motivated and is doing all the things, following my plan, and yet we're still stuck. And it's usually not, honestly, never, it's my first thing to offer people, but I have offered them, and I've done it in a couple of ways, Kaya. Like there are times where I will, it's maybe more of a classic situation if someone has diabetes and maybe they already have diabetes and obesity, or they have pre-diabetes and they have obesity. And this is a person where I'm probably going to follow the more classic algorithm around using these GLP-1s in the way that they are indicated. But then there are times where either because of patient preference or because I feel like we've got time, yes, I've used like off-label dosing or microdosing because I do think there are benefits around inflammation modulation, working on these metabolic metrics. And I don't know yet because it's like still an experiment, but what I'm curious about is if some of these smaller doses for longer periods of time, can help heal metabolism in a more fundamental way. Because while I do this very comprehensive approach that you're seeing, I still have had, like instances where we do a GLP-1 in the classic way, we slowly taper, we've built muscle mass, we've done all the things that we need to do, and the person gets off it and they gain some weight back, right? And it's very frustrating for this person. And so I think, I'm just in this place of being curious and obviously giving full informed consent and people, engage in this journey with me, but looking at this in a more nuanced way. Like I would never say that, we've got to throw the bathwater out on the baby all at the same time. Like I think we have to be really curious about what they can offer, and I do think it's positive overall.
Yeah, I'm so happy that you and other doctors are taking this very nuanced approach to it, because I do fully believe, especially when it comes to our health, it's so important to get somebody to a place where they feel like they're making some sort of progress. They feel at least a little bit better. And because if they feel like horrible for years and years and years, that's demoralizing. They're just maybe end up going backwards. And maybe this is an opportunity to get them to a place where they feel like, okay, I'm starting to feel good about my body, about the way that I look, the way that I feel, and I'm motivated to make all of these other changes as well.
I mean, what you said is so spot on, and it is a big piece of, you know, why I may go down that path with somebody, because they maybe have worked for 9 months, 12 months, they're doing all the things, they're taking their supplements, they're going to the gym, and maybe there's like, you know, a little bit of movement, but not in kind of congruence with the amount of effort they're putting into it. And it is hugely demoralizing and frustrating and can tap into some like deeply negative psychological things. So getting them into this new place, they see a change, they get a new level of motivation. I mean, it can be very powerful.
I want to go back to biomarkers, something you briefly talked about early on. I know our audience loves to hear the intricacies of that and labs and whatnot. So would love to just kind of get your sense of what are the biomarkers that you're also looking at?
Yes, it's also my favorite topic, so I relate. Everyone's going to get pretty comprehensive lab work when they come to me, but like if we're talking about this, so let's just put it into boxes. So let's start with like a more hormone kind of related aspect. So I will run a leptin level on people. This is a satiety hormone. And, you know, just like you can have insulin resistance, which I imagine your audience is pretty familiar with, right? When that system insulin that is secreted that manages glucose, when it's so out of balance that you need to insulin needs to be screaming to get the same message across, you can have leptin resistance, and they tend to track together, but not always. And so I will check a leptin level on people. If that number is above 10, I'm usually thinking that this person is dealing with some amount of leptin resistance. And that's important for me to know, because then I know that whole appetite, kind of satiety, that whole mechanism of things is also off, right? Then related to this, I'm going to do a fasting insulin. I'm going to do a hemoglobin A1C. I like fasting insulin to be below 5, even, as low as 2 or 3 sometimes, depends on the person. I've certainly seen people that are not 5 but are in their optimal, and I'm happy with that. So I don't want people to listen to this and say I have to be 5 or I'm not healthy. It depends, but 5 on average is a good place to land, or lower. Hemoglobin A1C I like to see around 5.3 or lower. I will look at a fasting glucose, which is optimally between 75 or 85. But glucose is a funny guy, right? If you're stressed or if you had a funny workout, I don't get too hung up on glucose alone. I'm looking at it in the larger stream of things. And then in the cholesterol panel, I'm going to look at an HDL to triglyceride ratio. And specifically, we really like, ideally, for HDL and triglycerides to be about 1-to-1. And if not, no more than, you don't want your triglycerides to be more than 2 times higher than your HDL levels. So those are kind of common ones, but I will also sometimes look at a uric acid level. And these are all metabolic markers. I'm going to look at liver enzymes to see, is there some fatty liver developing that we need to be curious about. So there we go, kind of on that little section, which I kind of combined metabolic and hormone in there. So let me add some of the other hormones at the same time. So a thyroid panel is going to be pretty comprehensive. So we want the TSH, the signal from your brain to your actual thyroid, and we want at least free T3 and free T4, the hormone-free levels of thyroid. I look at a reverse T3, and I always check for thyroid antibodies to see, sometimes the thyroid can look really good, the numbers, but the antibodies are creeping up. And this tells me, okay, there may be an emerging Hashimoto's type picture that's here. Sex hormones really depends on the age of the woman that I'm seeing. Are they on birth control? Are they not? How well can I really assess this system? But let's just say I can assess it because they're not taking any exogenous hormones or any birth control, nothing like that. And so I'm gonna, most commonly look at a day 3 to 5, FSH and LH. And this is probably more common if you have PCOS or you're in perimenopause or menopause. I don't always look at that for someone in their 20s or 30s. And that's just telling me how is that signal from the brain to the actual ovaries going, right? Are you moving, is that signal healthy? Are you moving along quite swiftly, or is there kind of a commentary to be made there? And then I like to look at a luteal phase, progesterone, estrogen, total testosterone, free testosterone, sex hormone binding globulin. And here you can see things low progesterone, high estrogen, these low testosterone, right? So that's a whole nother thing that we can talk about. And sum total, those are the common things that I'm going to look at when we're thinking about energy balance to support from blood work. But I'm also commonly doing a stool microbiome test and looking for, is there inflammation? Is there dysbiosis? Could that be impairing the mechanisms that control satiety as well? There are also strains you can look at to see how well they are present. There's a certain strain called Akkermansia that is a natural GLP-1 agonist. So does this person have no Akkermansia in their gut? Is that contributing to the problem they have? Those are things that I'm going to be curious about. And then sometimes I will also do like a saliva cortisol test to just see like, what's the stress dynamic in all of this? I live in Washington, D.C. I work with a lot of high achieving, like very, very high driving women, and they rarely think they're stressed. Rarely, right? Like they're like norm. Yeah. They're just like conditioned to living with such high levels of stress that if you ask them like, are you stressed? They're like, no, everything's fine. Like the house has to be burning down before they will tell you they are stressed. So it's useful for me to get objective about that too, because oftentimes someone who's like, no, I'm fine, you'll see their cortisol is actually through the roof.
And for somebody who doesn't have maybe the honor of getting to work with you and your team, they are going to their practitioner. I had a friend recently tell me, I'm thinking about wanting to get pregnant. I asked my practitioners, can we look at my hormones? They said not necessary. Do you have any advice for anybody out there, ways they can maybe talk to their doctor, like, hey, I would like to run some, because we know that some of these can be run through insurance.
Oh my gosh.
Yeah, if there's any advice there.
Yeah, I mean, I think, and I can look at this later, and maybe there's sometimes it's like you can hand your doctor a study about, like, let's say it's about fertility, right? Like about what thyroid markers are optimal for fertility. And maybe you'll have someone who's curious and open-minded and wants to read that and might think about it. Maybe not, right? So if that's not an avenue that can work, then I think that you could always just pay for it yourself and say like, listen, I'm grateful to be working with you. I know that you are very smart, whatever it is. I'm going to get these done myself. I'll pay for them out of pocket. There are lots of like direct to consumer labs that you can get these labs pretty affordable, right? It's accessible. But then maybe take it back to that doctor and say, I know that you weren't comfortable ordering these. And, to be fair, there are certain doctors, for example, that work at Kaiser or other places that they're under pretty strict control about what they're allowed to order or not. So sometimes it's like you may catch them and it sounds like they don't want to do it, but really it's more like somebody from above is really saying no to them. But they might be curious or open to interpreting them. And you could ask that question, if I get it done from an outside lab, would you be open to at least looking at it with me? And then, sometimes you just have to find somebody else. And I try to offer, besides working individually with me, and not to make a plug for myself, but just, I'm sure there are many people that do this. I have like an online health community where I help people with these kinds of questions. And, I'm not giving medical advice necessarily, but if someone was like, oh, my thyroid looks like this, what should I think about? That I could share something like that with them so that they know what to think about without having to see somebody one-on-one, which can be much more expensive. So whether it's me or I know that there are people that do this stuff out there, like finding a way to make it affordable by, direct to consumer labs, and maybe finding a practitioner that offers, here's guidance to think about. Maybe I can't give you medical advice, but here's some things to consider. Those would be the things that I would think about for those people. Because I agree, it shouldn't be that we just, give up in those situations. We should still persevere.
Totally. And it's great that there's so much education online too, that people can kind of take the information that they get from those direct to consumer labs. And like you said, they can be a part of your community. They can read about it online, and some of the information is actually,
there's so much stuff out there. Yeah.
Totally. I wanted to ask, when it comes to weight management, we talked about some of the like wearables and things that you recommend, or some of the devices. Are there any other specific therapeutics that you bring into your practice when helping somebody with weight management?
Yeah, definitely. I mean, fundamentally, I want to make sure that whole nutrient, hormone, gut microbiome, that stuff is all good, and the lifestyle stuff is all good. But sometimes we want to add in some additional tools there. So there are some things that I use quite frequently, and I'll name all of them, and I will also say talk to your provider. This is not necessarily a like go buy out all of these things and start them on yourself, but the things that I like are berberine. So this is a natural substance that can really help wrangle insulin. So this can be a good one when you're dealing with someone that has like more of a classic metabolic picture to their energy imbalance, but maybe are either not ready for a metformin, which would be like a more common pharmaceutical option, not ready for a metformin, or maybe have like strong feelings about getting on pharmaceuticals. This could be a reasonable alternative. It acts very much like metformin, but is, an over-the-counter supplement. And I will usually do about 500 milligrams 3 times a day, something like that. I also like green tea extract. It's like an amazing antioxidant. It helps with, fat thermogenesis specifically, and it supports the mitochondria. And, you probably have heard through all the knowledge you have, but in speaking with many providers that, the mitochondria at the end of the day is like the final step in all things. Like you need your mitochondria to be happy and healthy and robust. And anything that's going to support the health of that mitochondria is going to support your overall health. But in this particular instance is really going to help with metabolism specifically and how that energy balance is happening, like down to the level of the mitochondria. So that's another one, is green tea extract. I've often also used like natural GLP-1 agonists. So I was mentioning Akkermansia before. So there's a company that offers Akkermansia in the form, the actual name is GLP something, I can't remember the last part of it, but it's just a probiotic that will support the more microbiome aspect of this kind of, dynamic we're trying to support. So I've used Akkermansia before. There's also an extract, and I just did an Instagram post on this, a hops extract. So hops is also a natural substance. There's an extract from hops that helps with like craving management and also supports GLP-1. So for the right person, that can be really helpful. And then of course I do hormone replacement, and that can be anywhere from like, thyroid, maybe someone has subclinical hypothyroidism and maybe wasn't treated before, but now in this context, we really need to think about this. And then mostly, in perimenopause, menopause, but I would say the caveat to that is women with PCOS, I will sometimes give them progesterone to balance out some of the estrogen and testosterone dynamics that are happening in women in perimenopause and menopause, which is, we're having lots of conversations about that topic today too. But I guess the nuance there is I'm open to prescribing testosterone in women in these instances because it is a very important hormone stimulator of muscle synthesis, right? When we're young, like basically our hormones are driving like all of our muscle synthesis. And as we get older, it's really food and exercise, which is why we talk about like be protein forward, get your resistance training. But if I can add a little bit of that like hormone support in like a, physiological way to somebody who, could benefit in this journey, then I will. So I will use testosterone in women in those instances too. Those are probably the big ones.
Yeah, it's interesting because you don't hear people talking too much about testosterone. And I know early on you're like, yeah, low testosterone is something you think about and you can talk, more about that. I'm just curious, what are some of the negative implications of having lower testosterone? Is it the body composition piece that you talked about, which is so important, or?
Yeah, no, that's spot on, Yasmin. So body composition is going to be a challenge. Like sometimes you'll hear this story of like, I'm doing all the right things, but it's not like actually turning over into gaining muscle at all. In fact, like I'm either staying the same or maybe even losing muscle as I get older. So body composition is huge, but you can also see brain fog, fatigue. It's even like very common to struggle with depression when your testosterone is low. So it can span a lot of things. And, we just don't think about it enough, but I definitely think about it in this context. And it's, when you like kind of like push a little further in someone who's on this like journey around energy balance, you often will find, and it's probably multifactorial, but they are fatigued and they are dealing with mood stuff. And that's probably partially about, other mechanisms, but it's certainly hormonal as well.
I love that you mentioned all of those options because if there's anybody listening, that's the bottom line. There are other options, especially if you don't want to take pharmaceuticals like, you just mentioned all of these different things that could support their body or their weight loss journey in different ways. And also, as a plug to what you said about going to your doctor and potentially taking a study and saying, hey, would you want to take a look at this? There's a great example of that. Dr. Ralph Moss, who's like the #1 cancer doctor in the world, that's how he got into what he's in, because somebody came and said, hey, I saw this study on green tea extract for cancer, and I'm really interested. And he kind of blew them off, I think, at first. I might be getting the story wrong, but I don't think I am. And then he started to read it and was blown away by the amount of research on green tea extract and cancer, and then changed the trajectory of his career, essentially because what a patient did by bringing in a study. So you never know. If you're thinking about bringing a study to your doctor, maybe you want to try it. It could make a difference.
I love that you shared that story. That's so amazing. And I agree. I mean, I can't often read it right then, but everything people give me, I always read. I mean, I learn so much from my patients, because at the end of the day, like, they are such advocates for themselves that they often find things that like are not on my radar, right? I'm like in my little like medical community and not necessarily thinking about things like that. So yes, huge like champion for bring it in. And you know what? Worst case scenario, they don't take it and you've lost nothing. But best case scenario, maybe like change the trajectory of medicine. You know?
Totally. Well, I wanna end kind of talking about just in all the experience that you've seen with your patients, just some factors, whether it be around mindset, whether it be around scheduling, planning, like what are some common factors of people who have maintained weight loss successfully long-term? For anybody who's listening, who this is a long-term goal for them, what should they be thinking about?
Yes. Okay. So I would say on mindset, really like focusing on the wins, like staying in the winning energy. I would say scheduling the stuff that you need to get done, right? Whether that is like to meal plan or to exercise, it needs to be in your calendar. And then fundamentally, not sweating the small stuff after that, right? Like be in the win, gain mentality. I want to gain muscle. I want to like, you know, celebrate the wins that I have, and then kind of like dovetail that with, and here are all the times in my calendar I'm going to do it. And it will work. Like, of course you need to get to like a starting point, right? And that's kind of what we talked about in this whole, in this whole chat today. But once you're at that point where you're like, okay, I've arrived. Those would be the two things that I think really help people, just like, it's just part of life. You know, it's no longer a thing. It's just like what you do, like brushing your teeth.
Totally. And just to go off of that too, we know that there's so many foods that we don't recommend when somebody's on their weight loss journey, but are there foods that we do recommend that can support weight loss?
Yeah, so I mean, it taps into big categories of protein, getting that protein in there. You know, they do say like 1 pound for each pound of ideal body weight that you have. I find that's really hard for the women that I work with. So I usually say if you can hit 90 to 100 grams in a day, great, call it a day, you're good. So protein, fiber, right? Because that's going to support the gut microbiome. It's going to help with satiety signals. It's going to help with elimination and detoxification. There's so many little pieces of those root causes that fiber is going to support. Getting that 35 grams of fiber in a day. So my favorite there, to just make this like super concrete, is chia seeds, right? Like if you can just like go and do your chia seeds, because it's such a fiber rich per quantity item. Every morning there are 4 tablespoons of chia seeds in my like smoothie bowl, right? And most people don't mind them. Maybe if you've got some like sensitive GI stuff, you may have to like tiptoe into that. But like fiber, I think, is super essential. And then I love to say like getting good, like very good portions of vegetables in there. And that's gonna like add into the fiber thing, but also help with satiety and really the antioxidant kind of portion of your food, which will help with your mitochondria. Those would be the things that I say are really fundamental. Your veggies, your protein, and your fiber.
It doesn't have to be complicated is the bottom line. And it doesn't have to be expensive either, right? We're just focusing on whole foods, shopping, the outer. Exactly. Well, I just love your approach. I wish everybody had a doctor like you, truly. I think the world would be such a different place. But thank you so much for joining us and for talking about this.
It's so nice to be here. Yeah, I'm really happy to talk about what's like a very, important topic in this nuanced way with the most amazing ladies ever. Thank you for having me.